live from Evington Road, Leicester. And I've got to say, it's a beautiful morning out there. The sun is out. It's looking very, very good. If you're on Rosa number 11 or number 12, so Mubarak to you. I hope everybody's doing well. It's certainly going very, very quick for Ramadan. Actually, it's going very, very quick indeed. We're talking about health and well-being, and particularly today, we're going to be talking about vaccines and children's health. So we've got some of the leading experts from Leicester and Leicestershire here with us in the studio, Dr. Yusuf and Simran, who have come in, especially to talk to us about these subjects. Morning to you. Assalamu alaikum. Welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much for inviting us.
Thank you for coming in. We're going to be talking about vaccines. Now, if you've got any questions or you think that your child might not want one vaccine or you might not want to give any vaccines out to your children, please message us, email us, and tell us tell us why and what can we do to try and alleviate your fears. The telephone number to give us a call on is 0116 4822 22086, or you can send us a WhatsApp message 077 488 55055. We are live from Evington Road, and this is Radio Ramadan on 87.7 FM. So if there's any questions during the show you have, please don't hesitate. We are here to listen to what people have got to say, and if there's any concerns, it might be new to us, that it might help us to talk to people and deal with these issues and try and give you the honest truth about what the situation really is. So we're going to go straight into the main sort of questions. We know there's been an outbreak in London recently. The figures are quite high for measles. What is going on, and what can be done to try and stop measles spreading across the country?
Yeah, so the UK Health Security Agency have shared that since the start of this year, there has been so many cases, and most of the cases are in London and West Midlands, which includes Birmingham. And there are 5% of those cases are in East Midlands. And it's a big worry for us because 2-3 years ago, when we had measles outbreak in Leicester, it started in London, then it came to West Midlands, and then in Leicester. So it's a very important time for us to ensure that everyone is up to date with their MMR vaccine. And there's a new vaccine called MMRV vaccine, which is given to preschool children. So current message, we're just trying to make sure that everyone's up to date with their MMR vaccine.
And has that been part of the problem? Why there's been an outburst in London? Because people haven't been on having their regular MMR vaccine, so they've missed some of them or not had any at all. Has that been the problem, Dr. Yusuf?
I think that's largely been the problem. People are missing vaccines, and a lot of the time it boils down to certain trust issues and people not feeling like they need these vaccines. And the reality is that people oftentimes do not consider the risk of actually not taking these vaccines in the first place. So it's not about cajoling people or trying to convince people to take these vaccines. It's about people understanding what they are putting themselves at risk of.
Yeah, because you actually see the negative side. Yeah. You actually don't understand the positive side. Whereas you, I suppose, as a doctor, understands the positive side, thinking actually, well, hang on, this child coming into our hospital could have avoided coming into hospital if they'd had the vaccine, and it wouldn't have been a problem.
Exactly, and that's the reality that we're facing. The missed opportunities with vaccines, the missed vaccinations simply mean that these children or people that are more vulnerable are more likely to present to us with more critical illnesses, and that's the risk that we're facing. So oftentimes people think of vaccines as things that that are optional, but the reality is that we need to start thinking about these things as things that would prevent us from needless hospital admissions and needless deaths. And we've seen it even just with the COVID-19 vaccination.
It's not just death, it's pain and going through the treatment and going through everything else.
Exactly, and going through that pain, needless hospital admission, that has its impact on not just the patient themselves, but even the family members as well. We've seen how vaccines have, absolutely
smallpox and lots of other issues just been wiped out because of vaccination.
Absolutely, and if you think about the COVID-19 pandemic, we couldn't have survived that pandemic without vaccinations in the first place.
And you know, lots of people always say that they seem to think that, you know, they're doing a favour, but actually the cost of these vaccines is quite a lot of money. The government just doesn't decide that they want to give these vaccines out free of charge because they've got too much money. They value the finances, and they think actually this is so valuable for patients and for children in particular that we need to help them by giving them these vaccinations and stopping them from being seriously ill and ending up in hospital.
Mhm. Yeah, I think in some countries, you know, where some vaccinations are not for free, we are very privileged here to have NHS that provides free vaccinations that prevents diseases that are preventable by vaccinations. And just going back to the MMR outbreak currently, most of them cases are amongst children under 10. So again, it shows that young children are the most vulnerable for diseases like these, and it's very important to make sure they're up to date with the vaccinations.
And do you think that those people, the parents, are sometimes a bit misinformed or don't have the time to get to the GPs to get these vaccinations in?
I think there's a lot of misinformation, largely because of. I think it's easier for people to believe rumors than actually believe what the facts are saying, and that's what we need to be asking ourselves: are we finding out the right information from the right sources? Are we actually asking from the experts who have no vested interest? Are we finding out information from independent sources? That's the only way that you can, you know, really dispel your fear and anxieties.
So if people will look on the internet, there's lots of misguided, misleading stuff. They need to actually look at professional stuff, don't they, really?
Absolutely, and they need to be listening to the experts. The reality is that we see what the issues are on the ground. We see patients coming to us when they need not have been there in the first place. We see what the impact can be on not just the patient but the family and the wider society and the community. And the thing about protecting yourselves or taking vaccines is not just to protect your own self from an illness. It's also protecting the whole community as well. People that are vulnerable.
So and that's a really important point, because grandparents and they can be affected by their grandchildren who've caught something and pass it on to them, and for them it's really serious, isn't it?
And we see this happening quite a lot.
More than ever before.
We see this happening quite a lot. In families, especially in large families, where they've got older people that are unable, or maybe because they're immunocompromised, they're unable, or they've got cancer or something like that. So it's important that everyone plays their part in ensuring.
And Dr. Yusuf, what is your background? Because you're a doctor, but where are you originally from, and how did you end up in Leicester?
Yeah, so I'm a GP based in Leicester.
Which practice? Whereabouts in the city?
So Oak Meadow Surgery, around Glenfield area. Particularly migrated to this country in 2019 from Nigeria, and a lot of my work has also, and the reason why I'm passionate about this engaging the community is because of my work, helping Black and Brown migrant parents understand some of these issues and dispel their fears and have that education and support to make the right decisions.
And if you had children, you would happily give vaccinations to them and not worry about it?
I have got a child, and he is absolutely fully vaccinated, and I say this confidently because obviously it is something that I know the value of, not just as a medical practitioner, but as a parent to myself.
And in countries like Nigeria, they don't have these mass vaccination programs, do they?
They do. They do have mass vaccinations, and the interesting thing is, the HPV vaccine has just been recently introduced to the national vaccination schedule
in Nigeria.
In Nigeria,
okay. And that's the one we're going to talk about next. But
yes.
Yeah. Okay.
And the reality is that we know just how valuable it is, and how important it is, even in less developed countries as well.
So, and how's the uptake been in Nigeria?
So I would say that similarly, we are facing similar challenges to what we're facing here. A lot of vaccine hesitancy for understandable reason. But the reality is that there's a lot more. There's a lot more people are actually taking of vaccinations than the people that are hesitant to take them.
Hesitant to take it. You're listening to Radio Ramadan on 87.7 FM. Our telephone number for the studio is 0116 4822 086. or you can WhatsApp us on 077 488 55055. You're listening to Radio Ramadan on 87.7 FM. We're talking about vaccines. We've just spoken about measles. We're going to how do children get their measles vaccinations first of all, just so that parents are clear, because this is a big issue in the city of Leicester, in the sense that people accessing GP services and accessing mental health issues, and how do they go around to book their appointment? And is it that difficult for lots of people? Because, one of the first things that people say to us, I can't get an appointment with my GP. How am I going to get the vaccinations?
Mm-hmm. I think, again, the first main point of contact is your GP. So that's where everyone will get their main vaccination, the childhood vaccinations. But one good thing to tackle that issue of not getting GP appointment and make it easier for parents to get their children vaccinated, we have NHS have funded a roving health unit. So it's a mobile unit that just looks like an ambulance van that goes around different locations in Leicester, providing a few vaccinations currently, but they're aiming to bring childhood vaccination, all the childhood vaccination on there. So it currently does have the MMR and the MMRV vaccine. So again, that's another way where they can go get the vaccine. In terms of how to find the locations of them, there is a website. It's called, if you just search on the Google, vaccination LLR, which stands for Leicester, Leicestershire, Rutland, it will give you a very localized information about what vaccinations across all the life stages you should have, and where you can get those vaccinations, and from there you can also find out the locations of the roving health.
So if there's a roving vehicle outside a school or in one of the streets, in the shopping streets in Leicester, can you take your child inside, say, this is my child, need vaccination done? They will do it on the spot if you've got all the details. What details do they need to take with them?
Yes, so it's all walk-in, so you don't have to book an appointment.
So they can just walk in anytime. If it's there, they just walk in and wait.
Yes, they can just walk in, and the clinicians on the roving health unit will have the system to find out the child's history, vaccination history. So you just need to give your date of birth and your name, and they'll be able to find the vaccination history. And then if there's any vaccination missing, for example, the MMR vaccine,
that's missing, they'll do it. Yeah.
Yes.
So that is really simple for lots of people. Really. So they don't need to take any of the red book or any paperwork with them. Just walk into the roving vehicle and say that you need the vaccination. Just check if they're up to date.
Yes.
And they can check straight away. You give the details, and then you can have the vaccine done there and then and move on.
Yes.
May I just add, from a primary care perspective, most of the routine vaccinations people would get automatically invited for. And same with screening as well. So you would automatically get letters notifying you when the child is due for a vaccine. The key thing is looking out for your mails and responding to those invitations. I wouldn't think that a GP appointment would necessarily keep a child from being vaccinated.
Yeah.
These are priority issues. Primary care.
Yeah. Okay. Now we were talking about the HPV vaccine. There's a lot of hesitancy in Leicester about having the HPV vaccine. What is it, Dr. Yusuf, and how will it benefit people?
HPV is human papillomavirus vaccine. It's a vaccine that's important with preventing strains of the human papillomavirus. And this vaccine is important particularly because of the risk of it causing cervical cancer in women of reproductive age. I think there's a lot of hesitancy around this because of the fact that sometimes people tie this to sexuality. People think that people get HPV vaccine only from sexual means. Yeah. But the reality is that it's the HPV is a virus that has many different strains, and it is all over and pervasive all over the environment. So young boys would get it from from even the swimming centers or just.
So it can be picked up anywhere.
Picked up anywhere.
So it's not associated directly with that.
With that.
So that's the misconception, really.
That's the misconception that people do have. People think that if we're encouraging women to be promiscuous or young girls to be promiscuous, but that's not the reality. The reality is that cervical cancer is a deadly disease that any girl can pick up and can develop into something really serious when they get older. And it's important that if we can prevent that sort of cancer, by increasing the uptake of these vaccines.
And that cancer doesn't appear straight away. It's more like in the 40s, 50s, and later on in life.
Absolutely.
But that prevention at the young age
Yes.
will protect them for the rest of their lives.
For the rest of their lives, exactly. And that's why it's important that even not just girls, but boys also have these vaccines, because that's one of the oftentimes the carriers. So I think it's really not. I think the most important thing is not to sexualize or to associate it with it.
Yeah, the association is the downfall, isn't it?
Oftentimes.
Yeah.
And I'd just also like to mention that it just doesn't prevent cervical cancer for girls, but for boys and girls, it can prevent some types of head and mouth throat cancers and some types of genital cancers. So I think our main focus right now is to make people aware that HPV vaccine helps prevent from HPV-related cancers. So we're encouraging parents. So this vaccination is usually given in year 8 in school.
Yeah.
So we're encouraging parents to make sure when the consent form through your email comes to you, please give your consent, and the children will be getting their vaccination from school.
And if they miss the email, how can they get this HPV vaccine? Can they go online? Can they get another form? What happens? Or can they go to their GP or go to the clinic?
So for if a year 8 who's still in the school has missed it, every year when the vaccination team goes in back again, they will be received an email again. So, but if you want to get in touch, you can get in touch with school-aged immunization team of Leicester, and they'll be able to provide a clinic where you can go and get the vaccination. But one of the good things is that if a child has left the school and they yet had not got the HPV vaccine, they can still get it for free until the age of 25. And one of the ways is to go through your GP. But again, and as I mentioned, Ruby Health provides many different vaccinations, and HPV is one of them, and it's a really big success, especially because it just came in. We started having the HPV started this year, so that's another
So if somebody wants a HPV vaccine for their child, they can go to this roving vehicle, give their details, and they'll be able to get it. It's very simple. Why is the uptake so low, though? Is this misconception, or the ideas of the negative social media just taking over? Because I don't think this vaccine is very cheap either, but it's an expensive vaccine that has been offered for huge benefit for later on in life.
Yes, yeah. So my work in public health involves engaging with schools, and we'll be going out in parents' evenings and understanding what's the barriers. And firstly, I think it's lack of awareness. People they don't know, and again association with the sexual activity. But I think it's just about making them aware that it prevents from different types of cancers. And when parents hear that, they do think about this vaccine. Again, as we mentioned about making sure that the information wherever you get from is from the trusted sources. Again, the NHS website would be a great one to go to. But again, I just want to mention about a website called Vaccination Knowledge Project. It's a website created by the Oxford University. It's a great website. If you're hesitant about vaccination, want to get more information, it gives you all the information of the side effects, the ingredients of each vaccination, about the disease. Again, for getting more information about any vaccine.
And what's that website again?
It's called Vaccine Knowledge Project.
Vaccine Knowledge Project. So all the facts are actually there. Yeah. Because we're living in a world of myths, of misconception all the time. That this is not good for you, this is not good for you, and people, there's so much anti everything. But actually, if you consider it, the medical evidence is there. The actual costs, why would any government or any organisation spend money on something that they didn't think would work? It doesn't make sense.
Definitely. As Dr. Yusuf said, it has started in Nigeria. I just wanted to mention that I've seen that in India, it has currently also started the HPV vaccine. Again, encouraging young girls to start with to come and get vaccination. So we have been giving vaccination for a long period of time.
And do you think the more people who have it will help the life expectancy of people in the UK?
I think it's obvious that we're living longer and fuller lives now than we were many decades ago because of these sort of medical interventions, and these are innovations that should be applauded rather than
because people generally want to stay healthy. Will try and eat healthily. And especially in Ramzan, I try and eat even more healthily. Rather than having the samosas and the bhajos, I try and cut those back a little bit as much as possible. But but this is an opportunity to live longer.
Yeah.
And it is proven fact that you can live longer by making sure you are up to date with these vaccines, be it measles, be it HPV, and they're offered for free, but yet we don't take them.
Yes. Also, just to mention that NHS England has aimed to eliminate cervical cancer by 2040, and there's two ways to do that. It's one, making sure our 90% of population is up to date with the HPV vaccine, and secondly, that 70% of our cervical screenings are done. So again, whole support from the community is needed to ensure that we are able to achieve that aim of eradicating cervical cancer.
So we've got something being highlighted by Dr. Damien Rowlands, worth highlighting. Essentially, no cervical cancer cases. That is no cervical cancer cases in vaccinated population so far.
And that's brilliant. And
Yeah,
that is
mashallah, that's absolutely fantastic when you think about it like that.
Yeah.
That is a game changer.
It is absolutely a game changer. When you look at it from the perspective of women actually coming down with cervical cancer, it is a painful experience for anyone to have to go through. I wouldn't wish it on my enemy. And if you have an opportunity to prevent that sort of experience that can have a lasting impact on the entire family, and even generations unborn, it is important to consider it.
It's really important to consider it. And what other vaccinations are available out there? I know we're going to speak about RSU, the new one. What is that all about? What's it for?
So RSV vaccine is the respiratory syncytial virus. Is one of
Just say it slowly again.
respiratory syncytial virus.
Okay.
So it's one of the most common causes of respiratory distress, particularly in infants.
Right.
And the great thing about this vaccine is that it is one of the newest vaccines that have been, that's targeting this specific illness. It's one of the most important common causes of admissions to A&E, especially in the early infancy.
Yeah.
And it's only available to be given to women that are pregnant from 28 weeks and above.
Right.
That's the only way that we can reduce the likelihood of that child, presenting to A&E for RSV.
Yeah, and I know we're going to be speaking to Dr. Damien Rowlands about the RSV because that's his area of expertise in coming in. Just reiterate, Simran, where we can get these forms from so that people know and how they can access it. Because I know you're going to be leaving this very shortly.
Yes. Again, just mention about the HPV vaccine. Parents of children year 8 or whoever is in school and missed the HPV vaccine, they'll be receiving an email from vaccinations in school, and then there will be an online consent form to fill in for them. For childhood vaccinations, as Dr. Yusuf mentioned, it's about letters that you'll be receiving at home, and making sure that you contact your GP to book appointments. Again, lastly, to mention that Rovi Health Unit is again an opportunity to walk in and get some of the vaccination that are currently available on there. Thank you.
Excellent, thank you very much. We're going to take a short, quick break, and then we're going to be speaking to Dr. Damien Rowlands, who is the consultant paediatrician, child specialist at Leicester's A&E department. On 87.7 FM. We're here live from Evington Road. We're in the studio and we're talking about vaccines and children's health. You can call in on the studio number, which is 0116 4822 and on the WhatsApp number, or you can message us on WhatsApp 077 488 55055. Is everybody asleep this morning in Leicester? I don't know what's going on, but they're certainly taking it easy during Ramadan and probably a lazy Sunday morning, but the weather is great out there.
It's the first time it hasn't rained in
first time,
ages, so I can see why people are out of the bed.
They must be out there somewhere. We now have a special guest, Dr. Damien Rowlands, who's a children's paediatrician at Leicester Royal Infirmary, the Children's A&E department. He's been leading the Children's A&E department for a good few years now. A regular guest, actually. He's been on a few times at Radio Ramadan, so welcome to you this morning as well. Thank you. Thank you for coming in.
No, it's at all. It's great to be here. This is a unique opportunity.
Thank you. And I just wanted to ask, we were talking about RSV, the new vaccine. You see children coming into the A&E department. I mean, that's your forte. How do you think this impacts the numbers, and how do you think it will help you?
So a bit like cervical cancer, a bit like the MMR vaccine. This is a huge potential game changer. So RSV, as I think you kind of demonstrated, is a bit of a mouthful, respiratory syncytial virus. But a lot of people will have heard it as bronchiolitis.
So it's basically breathing.
It's basically it's breathing difficulty. And what happens is this very common virus causes your lungs to secrete mucus, and that mucus makes you a bit wheezy. It makes it harder for you to breathe. The majority of children who get it, usually less than 1 year old, gives them a cold, gives them a cough, and they get better. That's what happens in that. But there's this group of children who are unwell enough, and they stop feeding because it's difficult to breathe and feed at the same time when you're young. And they end up coming to the kind of primary care, visiting a pharmacist, because the parents are quite rightly worried about breathing difficulty. In a smaller proportion of children, but enough that makes our wards full, that you need some oxygen, and you need some help breathing, and you need some help feeding. And what this vaccine does is, in 70-75% of cases, it stops you getting this disease so severely that you're going to need to come to an emergency.
So it makes it much milder, so it's much more manageable.
Yes. Yeah. And we know from our experience in other countries that it can be really effective at reducing presentations to healthcare.
And let's be sort of straight about this. The A&E department, children's A&E department, see lots of these children come into the department yearly on a regular basis, don't they?
Yeah, one of the reasons that winter is such a difficult period for everyone is because the waiting rooms, both in GP practices and in emergency departments, are just completely swamped and full. And that's important because it's not just about the individuals. We don't want yourselves as a public to be waiting ages for healthcare. We know it's frustrating. But I also know, as a clinician who's leading a department, when the department is full, that's when mistakes happen because it's so busy, and that other children end up being harmed. So that's why this vaccine is really important. And as we've touched on kind of misconceptions, there is a big misconception about the more vaccines you have, somehow your body can't cope with that. Okay, let me just be really clear. Absolutely no evidence that your immune system works in that way. Yeah. It is not a case of the more we jab you, the worse it possibly becomes. It doesn't work like that. Yeah. So that's one thing. Just another vaccine on the schedule isn't going to do you any harm. Then there is this kind of challenges about the impact of vaccines in pregnancy, and I really get that concern from families. But again, we know that this is an effective vaccine. We've actually now been vaccinating tens of thousands of cases over the last couple of years, and we have no signal that there's any harm whatsoever. And there is a signal that we are preventing, especially young babies, becoming really ill.
And it's very risky for those young babies, because if the parent doesn't realise, it's very serious, isn't it?
Yeah. And I think the key thing, I think for everyone to realise, and I think this comes back to some conversations you had, it's really difficult sometimes for you to see the impact the vaccination has because nothing's changing in your child. Yeah. And I do see that. Yeah. It's a bit like when you take your car for a service and there's nothing wrong with your car, and you get a massive bill for this service which doesn't seem to provide you any benefit at all.
Yeah, because the car's still running.
Because the car's still running. Yeah. And there wasn't any problem before. But it's saving you that challenge down the line.
Yeah. Stopping the problems down the line.
Yes.
Yeah. And you know, I've been into the children's A&E department, and I keep picking up from lots of different parents that the young child, especially sort of 1 to 5 year olds, have been in A&E, have ended up in hospital on a drip, on oxygen, on a regular basis, particularly last winter. particularly cases over the last sort of 6 or 8 months. So this virus actually goes through lots of children and it's probably caught at the nursery.
And the elderly.
And the elderly.
We are vaccinating the elderly now as well, because we know RSV actually later in life, when your immunity wanes, causes problems. One of the reasons the NHS is in such a difficult situation over the winter period is the mixing of children and adults over the Christmas period, which does cause a lot of illness in the elderly population.
And the sort of dynamics of UK life, I could say, has changed as well, because lots more grandparents are picking up their grandchildren on a regular basis from school because the mums and dads are working, and they're vulnerable as well as the children.
Yeah, absolutely. Yeah. And I've got a question for Yusuf actually, because so the work that we have done at a big national project called Drunk Start, which was looking at how this virus has changed since COVID. And we've been doing a lot of work collecting data, but specifically asking mothers questions about why they have and haven't had the vaccine if their children ends up in hospital. And we're finding two big pictures. One is that there is some hesitancy concern about the vaccine, but also there is a concern about accessing the vaccine and how that happens. But for one of the things, we are a very multicultural place in Leicester, and I'd be really interested in your perceptions of how the RSV vaccine affects our different communities, whether your background is kind of white Caucasian or maybe you've moved to Leicester from another country. Do you think there are differences in these different cultures and populations?
I think definitely, we see a lot of more hesitancy from, diverse communities. And Leicester is a very diverse place, isn't it? And you find that a lot of people don't sort of trust, there's a lot of misconceptions and trust issues. So people feeling like there's an ulterior agenda or motive, from the government to eliminate certain ethnic groups or things like that. And for instance, I've had a family actually come to me saying, right in my GP room, consultation room, saying that they're opting their child out of vaccinations completely. I found that absolutely, it was something that I came to. I found that really, really serious. And the main reason that was given for this was simple. They can't hold anyone responsible if anything happens to their child because of vaccination. And this was a migrant family. So you see, these are genuine fears and concerns that people have. And the way I approached that situation, obviously, was helping them realize that the reality is that if they don't take these vaccinations, or because they're worried about something negative happening, or because they can't hold anyone responsible, who would be responsible if something bad happens to their child? And that's the way we need to be thinking about it. We need to stop sugarcoating it and realize that there are actually opportunity costs for taking certain decisions.
Yeah. And actually, I've had to take one of my children in the past to the A&E department, and it's painful to watch the blood's being taken from them, painful for cannulas to be, and actually, if you can avoid some of that pain for that child, as a responsible parent, you have to think, actually, these vaccinations, people are not just, the government's not just giving them out because they think it's something they wanted to do. They're paying a lot of money and investing a lot of time and effort to make sure that it helps people live a lot longer. And life expectancy rates in Leicester are generally lower than the national average. And particularly from the ethnic minorities, there is a complete health inequality in the way people look at things. And one of the things is Leicester's vaccination rate is so incredibly low, and we're one of the lowest in the country. And we need to do whatever we can to try and reach out to people, to try and actually help them, to say, actually, this is good for you, think about it, and make the decisions in the right direction. Because the vaccination today will prevent a huge amount of pain later on in life.
I mean, you made an excellent kind of point earlier on, and this is very specific to measles. One of the challenges is that measles, we don't see the side effects and problems it causes enough. Now, I say that, I mean, clearly we don't want to see measles, but because we've been so good at vaccinating, there is no one out there who knows what it's like to deal with a child who has, it's extremely rare, but the worst possible complication of measles is swelling around the brain, which will give your child brain damage, and they potentially may die.
Yeah.
And because we've been so effective with our vaccination program, no one knows about that.
People don't see them, do they?
People don't see it, so they don't see that consequence. But more importantly than that, there are a group of children who their parents may want their child to be vaccinated, but because of the child's underlying condition, they can't be.
Yeah.
So that child is at risk and will be at risk all their lives. We can help those children as well, because if we can get the vaccination rate to 95% or above, we know that we can stop outbreaks.
Yeah.
We need 95% of the population. And then everyone is protected, and you are doing what is best for the community. So if you really believe yourself to be a community citizen, this is what everyone should be throwing themselves at the moment. In some places in the country, it's below 85, perhaps even below 80%. Yeah. And that protects no one.
Yeah, so the more people that actually have it done, the better off we all are. Because actually, once you get to that critical number, 95%, there's nobody to pass it effectively.
Yes.
So it's like passing the parcel as a party game. You can't pass that.
You break the chain.
You break the chain.
Yeah.
And that's how I think Ring a Ring of Roses, the children's playground game came from, didn't it? Ring a Ring of Roses. So you actually break that ring of actually being able to pass it, and it's really vital. So it's not just about you yourself. It's about the wider contribution to the community.
Absolutely.
And that's what Islam teaches everybody, and that's what I think every religion teaches everybody, really.
Yeah.
Think about somebody else. Think about your neighbour. Think about whoever lives in your street. Think about other people rather than yourself. And unfortunately, we've ended up in a bit more of a selfish world than what we're all used to, I think, all of a sudden in the last few years. And we just need to readdress that, I suppose. That's the direction of travel. And you know, what are the other sort of children coming in with at the A&E department? What are the other sort of things that you look out for, really? You've measles, we've talked about RSV. What are the other things you think vaccinations are?
Well, we think so one of the things that interestingly, and this is really good news, because I'm glad we've not talked about it on this show, there's what's called a rotavirus vaccine. Rotavirus is the virus that causes diarrhea and vomiting. And that has been really successful. This is a vaccine that we give that stops children having a very common cause of diarrhea and vaccine. And you can actually see that the impact that has on the diagnosis of children with what the medical term is gastroenteritis, but you'll know it as diarrhea and vomiting. And we've clearly seen a reduction in children being admitted just for that diagnosis.
And does that give you a buzz when you think, actually, this vaccine, that whatever's gone out, is actually making a difference on the people coming through your front door?
So, I mean, it's brilliant. The flip side of that, and one of the challenges that we've got, is sadly, over time, there has been a greater public desire for minor illness and minor injury in children to be sorted out. And so, unfortunately, despite all the vaccinations that we give, the emergency department in Leicester is actually the busiest it's ever been. I think this January was the busiest January we've ever had.
Yeah.
And there are lots of reasons for that, and we've talked on this show. One of the challenges is because of that change in perception, and there's a bit of a double-edged sword here. We've been talking about a community of people who are worried about vaccination and don't want to take the offer of vaccination. But the moment their child becomes ill, within 12 or 24 hours, they're worried that something needs to be done. My child's got a fever, so it has to be sorted. I don't want them to have a fever. I don't want them to have breathing difficulty, so they seek help. And what's one of the challenges is, and we have to work so much better in healthcare, is the pharmacy is a brilliant source of information. 111 is a brilliant source of information. Primary care is a brilliant source of information. All these things can be used before you need to consider coming to the emergency department. But I do find it is this interesting debate where you've got on one side the public going, we're going to reject vaccinations and healthcare, but actually, the moment our child is, I want it sorted immediately.
Yeah.
And those two are in a bit of tension.
So, and actually, that prevention element is the most important one.
Yeah.
Because
Definitely.
you're going to prevent your child ending up in the A&E department by taking certain vaccines.
Yeah.
And if there is any misconceptions, I would urge people to maybe go and talk to some. There must be family members who work in the health service. I mean, there's 18,000 people that work at the hospitals just in Leicestershire. So there's so many people that you can speak to, or healthcare assistants or nurses, because they will have experience of some of these vaccines, and lots of those, all the staff, lots of them take. You can tell when a vaccine is worthwhile because the numbers of people who work in the NHS just take them all the time.
I was going to point out one common misconception, especially amongst the Muslim community, and some hesitancy around some vaccines containing
Gelatin.
Gelatin. Yes, exactly. I think there are only two vaccinations: the nasal flu vaccination and the MMRV, that do have pork gelatin as a stabilizer. But the reality is that, and this has been examined by the British Fatwa Council,
Yes.
that the final vaccination, the vaccine doesn't actually contain, significant amounts of this, and the fact that it is, being given for treatment purposes, it doesn't make it something that we should stay clear of. Also, there's the reality that there are alternatives to these vaccinations, so people shouldn't hesitate to ask for this if they're still worried.
Still worried, they can ask and get
Exactly.
a slightly different vaccination.
Exactly. So the nasal flu vaccine, they've got the injectable one, which doesn't contain anything like that. And
so the point is, if you're not happy with that element of it, even though it might be okay, is you can use an alternative. But please reach out and use the alternative.
Yeah, absolutely. So it shouldn't be a reason why. And then also, vaccinations do not break your fast in Ramadan.
Yes, that's right.
So it's absolutely fine to have it even when you're fasting.
And it's one of the reasons I like coming on programs like this is to hear that local community advice, because that's something I would have never have realised saying without hearing here. But as a white cis male, okay, I'm perhaps not the best person to speak to some other communities, but yourselves as community leaders are. And my ask on all of these programs is, as community leaders, you need to reach into your communities, because the communities will want to hear those messages from yourself.
And you're right, David. The reality is, if people out there who are able to pass these messages on, please do that. Because we're all role models, we're all people in our communities, and we'll all have friends. So even if you're listening to this discussion, please pass our messages on to other people you know, family members, children, grandchildren. Just generally speak to people and pass the message on, because you can all tell anybody what we've heard today and pass that message on, and that will vibrate through the whole community. And what we're doing is helping everybody. And helping everybody. This is the month of Ramadan. It's all about giving. And giving advice is also just as important.
Absolutely. And I think we need to start using our trusted voices. So if you've got a platform, or if you're an imam, or you've got people that trust your advice, I think it's important that we start speaking up. What we find is that rumors spread a lot faster than what is actually true, and that's the problem. People say false things, and that dispels creates fear and anxiety. And the people that have got the right information are not speaking hard enough. So
then we need you to speak out. So that is really important, because we can speak in the studio, we can pass the messages on, but you're in your unique positions. Maybe some head of your families, or you've got young children, or children who are married, having children. So please pass those messages on. Protect your grandchildren, protect your children. This is all going to work for the better. And we can, and somebody's asking a question, can we have vaccines during Ramadan? And yes, you can. That's been confirmed. Please ask the imams, they will tell you the same thing. It's been a great show. We're running out of time, but I just wanted to say thank you to Dr. Yusuf, thank you Damien Rollins, thank you to Simran as well. Absolutely great to have you in the studio today. Please, a big thank you on behalf of the listeners to the people who work in the NHS, primary care, secondary care, the hospitals, on the front line, health protection as well. Really good to have you in the show. Thank you very much for coming on. Please join us again next week at 11 till 12. We'll be we're talking about another health and wellbeing subject. Thank you.
Thank you very much
Thank
for
you.
having us.
Thank you.